As many of us know, October is Breast Cancer Awareness Month, and after a woman is diagnosed, she faces several options for reconstructive surgeries. Joining us this morning to talk about those options is plastic surgeon Dr. Jennifer Walden. Good morning.
Morning.
So happy to have you with us this morning. So, you know, when we talk about breast cancer, we're talking about something that really kind of hits close to home for you.
Absolutely, it does. My mom was diagnosed with breast cancer at age 68, and she had a mastectomy with immediate breast reconstruction, and a mammogram saved her life in the interval of 1 year.
Wow, and when you think about, because she's now considered to be cancer-free, correct?
Correct.
So definitely good news. When we talk about mammograms and other ways to check yourself, there's some new technologies when it comes to checking yourself to see if you have a lump or possibly cancer.
Right. Digital mammography is great. We can blow up the image on a computer screen. MRI or magnetic resonance imaging, ultrasound can all help in screening for breast cancer, as well as a clinical breast exam by your physician is a tried and true method and should be combined with mammography.
And of course, we always want to tell women to make sure they do those self-checks at home.
Right. A self-breast exam once a month around the same time every month in front of the mirror can help you just get in tune with your breasts and how they feel, and is there a change from month to month.
Absolutely. So now let's hone in a little bit on your specialty.
Sure.
You know, after a woman is diagnosed with cancer, and if she has to have one or both of her breasts removed, lots of options when it comes to reconstructing.
Right. And, you know, it's a multidisciplinary team approach for a breast cancer patient these days. So the mastectomy will be done, and then federal legislation mandates that an immediate breast reconstruction can be covered by insurance. So that can include tissue expansion and implant reconstruction, or taking tissue from the abdomen or tummy, from the buttock, or from the back, and reconstructing a natural feeling breast mound.
And you know, that's really interesting because that's becoming a very popular option nowadays, opposed to getting an implant in.
Absolutely, and that's what my mom had, a deep flap where tissue is taken from the tummy and hooked into the blood vessels of the chest wall, and she has a wonderful reconstruction.
Now, some people are concerned that sometimes if you just remove that fat and put it back in, it can be absorbed by the body. I know that was something that they say is a concern. Do you see that a lot, or do they generally stay?
With new techniques in attaching the blood vessels, it applies immediate blood supply to that flap, and so we don't see a lot of that. There is something called fat transfer that is an adjunctive procedure for contour deformities around implants and flaps, and we are having new technology that helps that survival of the fat. So there's really some elegant techniques in breast reconstruction these days, so women don't have to feel deformed right after a mastectomy in the olden days.
Right, which is great. And now a lot of the other thing people worry about is after you have been cleared and you get this reconstructive surgery, you still have to do these breast check and get exams to make sure that the cancer does not come back.
Oh, sure. You're going to be on a tight schedule every 3 months for a while, 6 months. Every year you're going to be getting mammograms and MRIs on the breasts, and on the reconstructed breast will be getting checked as well for recurrence.
And now, so a lot of people worry, well, you know, we want to bring that image back up. The implant or the flap is actually put in behind, so you would still be able to feel, correct?
Right, and this is just a diagram of a breast implant. And so if a woman who has breast implants also needs to check her breasts and tell the mammographer about those implants in place. But this implant actually is making that lump a little more palpable. It pushes it up to the surface of the skin, and the implant's under the muscle, so that really can help with mammography and aid in the visualization of breast tissue in people with a breast implant.
All right, fantastic. Well, Dr. Walden, we thank you so very much for joining us this morning.
And
of course, to learn more information about breast cancer detection, treatment, and reconstruction, you can just visit Dr. Walden's website at drjenniferwalden.com.